It's a really good opportunity. It's a really great question again, because it's a great opportunity to think about how you manage asthma. And I do not see FeNO on its own. FeNO should be incorporated, as you've mentioned, into the whole management pathway, with the patient absolutely at the centre of that, and the patient journey at the centre of it. And so it gives you an opportunity to rethink your pathways for a second. If you're not doing, FeNO is part of effectively a structured review of asthma, which goes with symptom scores, which goes with spirometry, for example, or certainly peak flow testing, which may go with blood testing, and also with FeNO. So you've got to have a structured approach, and FeNO is part of the structured approach. We know that having a structured approach to asthma improves outcomes, so let's do it. And if FeNO is the thing that helps us structure that diagnostic pathway and management pathway particularly, then all the better. So I think it's really important to, in primary care particularly, think about your whole asthma pathway. Patient comes in with symptoms of asthma, or maybe having had an attack or something even worse. You've got to have a structured way of taking the history, looking at triggers, looking at impact, looking at potentially then compliance or with the treatments, etc., and previous history. You want to have a structured approach to then the diagnostic testing, which will be spirometry and FeNO, potentially blood eosinophils, markers of allergy, etc., that comes out of the history, and then a structured approach to management with a clear way of starting treatment, perhaps driven by FeNO, but certainly saying, you know what, you've got inflammation, you need to be on an inhaled corticosteroid, let's get you on it, and then let's review. So structure review to close the loop is also really important.